Your mouth isn't just a place for chewing or brushing, it's the gateway to your entire body. Inside your mouth lives a complex ecosystem of bacteria, your oral microbiome, which plays a critical role in controlling inflammation, regulating your immune system, supporting digestion, and even balancing your metabolism. When these bacteria are healthy, they act as guardians, preventing harmful microbes from taking over, reducing systemic inflammation, and sending signals that keep your body functioning optimally. Most people have no idea that their daily habits are quietly destroying this delicate ecosystem. Standard toothpaste and mouthwashes contain harsh chemicals that kill both good and bad bacteria indiscriminately. Sugary diets feed harmful bacteria, tipping the balance toward disease. Even seemingly harmless habits, like skipping meals, not hydrating properly, or brushing too aggressively, can disrupt the oral microbiome, setting the stage for chronic inflammation, gum disease, and even immune system dysfunction. The consequences aren't just in your mouth. A damaged oral microbiome can increase systemic inflammation, impair nutrient absorption, worsen digestive issues, and make weight management more difficult. Yet most dental advice focuses only on appearance and cavity prevention, ignoring the profound effect oral health has on your entire body. Today, you're going to learn a doctor-approved science-backed oral care routine that restores the beneficial bacteria your body needs. This approach reduces inflammation at the source, strengthens your immune system, and protects your whole body health naturally. You'll discover simple daily steps that replace harmful habits with restorative ones, showing how small changes can transform your mouth and your metabolism. You'll understand why oral care isn't just cosmetic, it's foundational for your long-term health, energy, and vitality. The oral microbiome is a complex living ecosystem of trillions of bacteria, fungi, and other microorganisms that inhabit every surface of your mouth, your teeth, gums, tongue, and even the lining of your cheeks. Far from being passive residents, these microbes play a dynamic role in maintaining your health, constantly communicating with each other, with your immune system, and with other microbial communities throughout your body. A healthy oral microbiome is incredibly diverse, containing hundreds of species working in harmony to protect against harmful pathogens and maintain balance. When this balance is disrupted, pathogenic bacteria can dominate, causing local issues like gum inflammation and tooth decay, and systemic problems such as chronic inflammation, immune dysregulation, and metabolic disturbances. Your mouth is the entry point for everything you ingest, and the bacteria there are your first line of defense. These microbes detect harmful invaders and produce antimicrobial compounds to prevent infections from taking hold. They also educate your immune system, teaching it to distinguish between harmful pathogens and harmless or beneficial organisms. This education ensures that your immune system responds appropriately, activating when needed and remaining calm when no threat exists. It's reducing unnecessary inflammation that could damage tissues throughout your body. The oral microbiome does not function in isolation. It communicates directly with the gut microbiome through swallowed saliva, immune signaling, and metabolic byproducts. Beneficial oral bacteria can support gut health by introducing helpful microbes that maintain intestinal balance, aid digestion, and protect the gut lining. Conversely, overgrowth of harmful oral bacteria can seed the gut with inflammatory species, contributing to leaky gut, poor nutrient absorption, and gastrointestinal disorders. This connection explains why poor oral health is consistently linked to conditions like irritable bowel syndrome, metabolic syndrome, and systemic inflammation. Beyond digestion, oral bacteria influence critical metabolic pathways. Certain species in the mouth help produce nitric oxide from dietary nitrates, a molecule that supports vascular health, regulates blood pressure, and enhances circulation to tissues throughout the body. Nitric oxide also plays a role in immune defense and energy metabolism, demonstrating how oral microbes can impact functions far beyond the mouth. When the oral microbiome is compromised, these pathways are impaired, reducing nitric oxide production, increasing oxidative stress, and contributing to chronic disease risk. A healthy oral microbiome also optimizes nutrient absorption. Saliva, which is modulated by oral bacteria, contains enzymes that begin breaking down carbohydrates and fats before they reach the stomach. This early digestion reduces the burden on the gut, enhances assimilation of vitamins and minerals, and supports energy metabolism. The immune modulation provided by oral microbes ensures that your body can absorb nutrients efficiently without triggering excessive inflammatory responses, which otherwise consume antioxidants and deplete vital cofactors. Understanding the oral microbiome from a root cause perspective reframes oral care as foundational to total body wellness. Treating gum disease or cavities without addressing microbial imbalance addresses symptoms, not cause. Rebuilding and protecting beneficial oral bacteria reduces systemic inflammation, improves immune resilience, supports cardiovascular health, optimizes nutrient utilization, and strengthens digestive function. The mouth is the gateway, and oral health is not just a cosmetic concern or dental issue. It is the cornerstone for a healthy metabolism, balanced immune system, and optimal energy levels. When you grasp this connection, it becomes clear why restoring your oral microbiome is not optional. It is essential. The bacteria in your mouth set the tone for the entire body. By supporting microbial diversity, preventing pathogenic overgrowth, and nurturing beneficial species, you create a cascade of health benefits that extend to every organ system, every metabolic pathway, and every immune response. Oral care, when approached scientifically, becomes a tool for total body health, not just fresh breath or sparkling teeth. Many people unknowingly sabotage the delicate ecosystem of bacteria in their mouths every day, believing they are protecting their teeth and gums, when in reality they are creating an environment where harmful microbes thrive and beneficial ones die off. One of the most common culprits is fluoride and chemically laden toothpaste. While marketed as cavity preventing, these products are highly antiseptic and indiscriminately kill both harmful and protective bacteria. Over time, this reduces microbial diversity, weakening the oral microbiome's ability to defend against pathogens and regulate inflammation. Harsh detergents and whitening agents further strip away protective biofilms, leaving gums and teeth vulnerable. Alcohol-based mouthwashes are another hidden danger. They create an immediate sensation of cleanliness, but the effect is superficial and destructive. These mouthwashes disrupt the microbial balance, killing beneficial species that produce antimicrobial peptides and support nitric oxide production. Repeated use can lead to dry mouth, reduced saliva flow, and a higher risk of gum disease, tooth decay, and systemic inflammation. Diet is a silent, yet powerful, contributor to oral microbiome imbalance. High sugar and ultra-processed foods feed pathogenic bacteria, promoting overgrowth that produces acids and toxins. Acidic drinks like soda, fruit juices, and refined carbohydrates lower the oral pH, eroding enamel and fostering bacterial populations that trigger gum inflammation. Frequent snacking compounds the problem, keeping the mouth in a chronically acidic state that favors disease, causing species over protective ones. Hydration and breathing patterns also play a crucial role. Poor hydration reduces saliva production, impairing the mouth's natural cleansing and buffering systems. Saliva is not just water, it contains enzymes, antimicrobial proteins, and minerals essential for microbial balance. Mouth breathing, common during sleep or due to nasal obstruction, dries oral tissues, alters microbial communities, and increases inflammation, creating conditions that compromise systemic health. The consequences of these habits are not limited to your teeth and gums. Hidden signs of oral microbiome imbalance often appear subtly. Persistent bad breath reflects bacterial overgrowth and toxin accumulation. Bleeding or swollen gums indicate chronic inflammation and loss of protective bacteria. A white coating on the tongue signals fungal or bacterial imbalance. Cravings for sugar or refined carbs may result from bacterial signaling that influences appetite and metabolism. Digestive upset, including bloating or irregular bowel habits, can arise when pathogenic oral bacteria seed the gut. Fatigue and recurrent infections reveal that immune modulation by the oral microbiome has been compromised, leaving the body less capable of controlling inflammation and responding to pathogens. Recognizing these habits and their hidden effects is critical. Treating symptoms without addressing root causes, such as switching toothpaste or using stronger mouthwash, may temporarily mask problems but fails to restore microbial balance. The clinical consequences extend far beyond the mouth. Chronic inflammation, nutrient malabsorption, impaired nitric oxide production, and increased risk of systemic conditions are all downstream effects of oral microbiome disruption. By identifying and correcting these behaviors, you not only protect your teeth but strengthen your immune system, support digestive health, and reduce systemic inflammation, creating a foundation for total body wellness. When the oral microbiome is compromised, harmful bacteria can escape the mouth and travel to the gut, setting off a cascade of systemic effects. These bacteria, along with their metabolic byproducts and toxins, enter the digestive tract through swallowing, where they can disrupt the delicate balance of the gut microbiome. Pathogenic species outcompete beneficial gut bacteria, leading to dysbiosis, impaired nutrient absorption, and breakdown of the gut barrier, a condition known as leaky gut. Once the gut lining becomes permeable, bacterial fragments and inflammatory molecules escape into the bloodstream, triggering systemic inflammation that affects multiple organs and tissues. Chronic inflammation originating from oral dysbiosis has been directly linked to cardiovascular disease. Studies show that bacteria from inflamed gums can adhere to arterial walls, promoting plaque formation and vascular dysfunction. Inflammatory cytokines released in response to oral pathogens further contribute to endothelial damage, increasing the risk of heart attacks and strokes. The connection is not coincidental. Oral health is a critical determinant of cardiovascular resilience, and gum disease is an independent risk factor for heart conditions. Autoimmune conditions are also influenced by oral microbiome imbalance. The immune system is constantly communicating with oral bacteria, learning which microbes are harmful and which are beneficial. When the microbial ecosystem is disrupted, immune signaling becomes dysregulated, increasing the likelihood of inappropriate attacks on the body's own tissues. This mechanism underpins conditions such as rheumatoid arthritis, lupus, and other chronic inflammatory disorders. Oral pathogens act as triggers, amplifying immune activation and perpetuating systemic inflammation. Metabolic health is equally affected. Oral bacteria influence insulin sensitivity through inflammatory pathways and nitric oxide production. Nitric oxide, generated partly by oral microbes acting on dietary nitrates, supports vascular function and glucose metabolism. When these bacteria are depleted, nitric oxide production falls, vascular tone is impaired, and insulin resistance develops more easily. This contributes to weight gain, fatigue, and a higher risk of type 2 diabetes. Fatigue and general malaise are often overlooked consequences. Oral inflammation produces systemic inflammatory mediators, which interfere with mitochondrial function, reduce energy production, and increase oxidative stress. The crosstalk between oral and gut microbiomes means that a small imbalance in the mouth can have far-reaching consequences, impacting energy levels, cognitive function, and overall resilience to infections. Understanding these mechanisms highlights why oral care cannot be isolated from general health. Treating symptoms such as gum bleeding or bad breath without restoring microbial balance addresses only the surface problem. By supporting beneficial oral bacteria, reducing pathogenic overgrowth, and maintaining healthy microbial communication between the mouth and gut, you reduce systemic inflammation, protect vascular and metabolic health, and strengthen immune regulation. Oral microbiome health is therefore not a minor aspect of wellness. It is a foundational determinant of long-term health, energy, and disease prevention, and restoring it has measurable effects on the entire body. Restoring your oral microbiome requires a methodical, evidence-based approach that removes harmful bacteria while protecting and nurturing the beneficial species that support total body health. The first step is cleansing without destroying microbial diversity. Traditional toothpaste and alcohol-based mouthwashes are too harsh, eliminating both harmful and protective bacteria. Instead, gentle methods like using a soft, bristled brush with water or a very mild, natural toothpaste allow you to remove debris and plaque while leaving biofilms intact. Brushing should be focused on removing food particles and plaque mechanically rather than chemically sterilizing the mouth. Tongue cleaning is also important, as the tongue harbors bacterial communities that influence the entire oral ecosystem. Gentle scraping or brushing stimulates saliva flow and reduces pathogenic overgrowth without harming beneficial microbes. Dietary support is equally critical. Beneficial oral bacteria thrive on a nutrient-rich diet that includes leafy greens, fermented foods, and polyphenol-rich plant compounds. These foods provide probiotics and micronutrients essential for bacterial metabolism, immune signaling, and nitric oxide production. Avoiding sugar, refined carbohydrates, and highly processed foods starves pathogenic bacteria while reducing acid stress that erodes enamel and favors harmful species. Chewing fibrous vegetables stimulates saliva and naturally cleans teeth while supporting bacterial balance. Certain supplements such as vitamin C, coenzyme Q10, and zinc strengthen gum tissue, support immune defense, and enhance microbial resilience. Natural antimicrobial practices, rather than harsh chemicals, help maintain a balanced microbiome. Oil pulling with coconut or sesame oil is an example, creating a mechanical cleansing action that traps and removes debris while supporting microbial diversity. Herbal rinses using antimicrobial botanicals such as green tea extract or chamomile can reduce pathogenic bacteria without sterilizing the mouth. These practices complement diet and hygiene, creating an environment where beneficial bacteria can thrive and pathogenic species are suppressed naturally. Hydration and breathing patterns are often overlooked but essential. Adequate water intake maintains saliva flow, which contains enzymes and antimicrobial peptides critical for microbial balance and digestion. Mouth breathing reduces saliva, dries oral tissues, and favors pathogenic overgrowth, so nasal breathing should be emphasized during the day and especially at night. Saliva enhancing strategies including chewing sugar, free fibrous foods, and stimulating salivary reflexes support digestion, nutrient absorption, and nitric oxide production. The combination of these steps creates a rapid and sustainable restoration of the oral microbiome. Unlike conventional toothpaste or alcohol-based mouthwashes, this approach selectively removes harmful bacteria while preserving and enhancing beneficial species. The result is reduced oral inflammation, improved immune signaling, better digestion, and optimized nitric oxide production, all of which have systemic benefits. When implemented consistently, changes in microbial composition can be seen within days, and measurable improvements in gum health, breath quality, and overall inflammation typically occur within 2 to 4 weeks. This routine works because it addresses the root cause, microbial imbalance. It does not mask symptoms or provide temporary cosmetic benefits. It restores function. By protecting microbial diversity, nourishing beneficial bacteria, and supporting the oral environment with hydration, diet, and natural antimicrobial practices, you strengthen the foundation for whole body health. The oral microbiome is not just about teeth or gums. It is a central hub that influences immunity, metabolism, vascular function, and digestive efficiency, and following this routine ensures it performs optimally. Optimizing the oral microbiome requires more than brushing and gentle cleansing. It demands a nutrient-dense diet and lifestyle practices that support microbial diversity and resilience. Nitrate-rich vegetables such as spinach, arugula, and beetroot play a critical role in oral and systemic health. Certain oral bacteria convert dietary nitrates into nitric oxide, a molecule that improves vascular function, enhances immune defense, and regulates inflammation. Without these foods, oral microbes cannot perform this essential function, impairing blood flow, digestion, and energy metabolism. Polyphenol-rich foods, including berries, green tea, dark chocolate, and herbs like oregano or rosemary, provide antimicrobial and antioxidant support. These compounds selectively suppress pathogenic bacteria while promoting beneficial species, reducing oxidative stress in oral tissues and helping regulate systemic inflammation. Minerals such as calcium, magnesium, and phosphorus strengthen tooth enamel and support saliva production, which is central to maintaining microbial balance. Collagen-boosting nutrients, including vitamin C, glycine, and proline, reinforce gum tissue and the oral mucosa, providing structural support for microbial colonization and immune function. Anti-inflammatory fats from sources like olive oil, avocado, and oily fish help modulate immune responses and reduce oral and systemic inflammation, creating an environment where beneficial bacteria thrive. Daily lifestyle habits are equally important in preserving oral microbial health. Proper hydration ensures consistent saliva production, which contains enzymes, antimicrobial peptides, and minerals essential for bacterial balance and digestion. Saliva acts as a buffer against acids, prevents overgrowth of pathogenic bacteria, and facilitates the initial breakdown of nutrients. Nasal breathing, particularly during sleep, protects oral tissues from drying, maintains optimal pH, and supports beneficial microbial populations. Mouth breathing, by contrast, creates a dry, acidic environment that favors harmful species and increases systemic inflammation. Stress reduction is another crucial factor. Chronic stress alters immune function and inflammatory signaling, which disrupts microbial balance in the mouth and gut. Practices such as meditation, deep breathing, or gentle movement regulate cortisol levels, enhance immune resilience, and protect oral and gut microbiomes. Sunlight exposure and sufficient vitamin D production support immune modulation and barrier function, which in turn supports microbial diversity and reduces susceptibility to infection. Together, these dietary and lifestyle strategies create a positive feedback loop. By nourishing beneficial oral bacteria and protecting their environment, you reduce inflammation locally and systemically, enhance nutrient absorption, and strengthen immune function. A well-supported oral microbiome communicates with the gut microbiome, ensuring efficient digestion, protecting the gut lining, and reducing leaky gut risk. Over time, these strategies result in improved energy levels, fewer infections, better cardiovascular and metabolic function, and more robust overall health. The practical application is simple but powerful. Prioritize nitrate-rich and polyphenol-dense foods, support gum and oral tissue with collagen, building nutrients, maintain hydration, breathe through the nose, manage stress, and ensure sunlight exposure. These measures work synergistically with cleansing routines and gentle antimicrobial practices, accelerating oral microbiome restoration and creating a foundation for lifelong health. Oral microbial balance is not a luxury or cosmetic goal. It is a clinical necessity that underpins immunity, digestion, and total body resilience. Start your day by gently rinsing your mouth with water immediately upon waking. Overnight, saliva production decreases, allowing bacteria to accumulate. A simple water rinse removes debris without disrupting beneficial microbes. Follow with gentle tongue cleaning to stimulate saliva flow and remove surface biofilm. If desired, brush lightly with a soft, bristled brush using minimal or no toothpaste, focusing on removing plaque without stripping microbial diversity. Hydrate immediately with a glass of filtered water to kickstart saliva production and support oral and digestive function. Breakfast should include nitrate-rich leafy greens, protein, and healthy fats, which feed beneficial bacteria and enhance nitric oxide pathways that support vascular function, immunity, and energy. Mid-morning, maintain hydration with small sips of water, supporting continuous saliva flow and microbial balance. Chewing fibrous snacks like raw vegetables or nuts naturally cleans teeth and stimulates saliva. Avoid sugary or processed foods that feed pathogenic bacteria. Incorporate short periods of deep breathing or meditation to reduce cortisol and protect immune signaling, which has a direct impact on oral and gut microbiome communication. Nasal breathing should be emphasized throughout the day to prevent oral tissue drying, maintain pH balance, and protect beneficial bacterial populations. At lunch, prioritize nutrient-dense foods that continue to nourish your oral microbes, including polyphenol-rich vegetables, lean protein, and anti-inflammatory fats. After meals, rinse with water or perform gentle oil, pulling with coconut or sesame oil for a few minutes to remove debris while preserving microbial diversity. Hydration remains crucial, with frequent sips of water rather than large amounts at once, to maintain saliva consistency and oral buffering capacity. Gentle movement outdoors provides sunlight exposure for vitamin D, supporting immune modulation and tissue repair. During the afternoon, reduce stress and maintain hydration, chewing fibrous foods when possible to stimulate saliva and mechanically support microbial health. If cravings occur, address them with nitrate or polyphenol, rich snacks rather than refined sugars, which disrupt microbial balance. Evening meals should be lighter, rich in vegetables, moderate protein, and healthy fats, limiting starches and refined carbs that fuel pathogenic oral species. Before bed, perform the final oral hygiene steps: gentle brushing or water rinse, tongue cleaning, and, if desired, a natural antimicrobial rinse such as diluted herbal extracts. Ensure you are well hydrated and practice nasal breathing during sleep to maintain a moist oral environment and prevent microbial imbalance. Collagen-supporting nutrients such as vitamin C or bone broth can be included with dinner to aid gum and tissue repair overnight. Within 24 hours, you may notice a fresher mouthfeel, reduced dryness, and more stable energy. By day 7, breath may improve, gums feel less inflamed, and small changes in digestion and appetite regulation may be observed. After 14 days of consistent practice, clinical improvements include reduced gum bleeding, better oral pH balance, stabilized energy levels, improved digestion, and reduced systemic inflammation, reflecting the restoration of oral, gut microbial communication, and immune regulation. Restoring your oral microbiome has profound effects beyond the mouth. Healthy oral bacteria signal the immune system appropriately, reduce inflammatory load, enhance nitric oxide production, and support digestion and nutrient absorption. These benefits cascade through the gut, improving microbial diversity, protecting the gut lining, and reducing leaky gut risk. Oral microbiome restoration strengthens immunity, optimizes metabolic function, and promotes long-term wellness. By following this practical, evidence-based routine, you are not just protecting your teeth, you are creating a foundation for total body health, energy, and vitality that will sustain you for years to come.